If you wake up to a wet patch on your pillow in the morning, that drool is what is left of any excess saliva that escaped your mouth while you slept. We all produce saliva regularly, including when we sleep, and sometimes people drool as a result. Is drooling during sleep normal? In many cases, drooling during sleep is normal. Saliva production varies over the course of a day, perhaps according to a circadian rhythm. Although people generally produce more saliva during the day and less at night, saliva production continues during sleep. This saliva performs the important task of keeping your mouth and throat lubricated, which is required for good health. Continued production during sleep makes drooling possible. Although drooling while asleep is often normal, it might lead to unwanted consequences. For example, excessive drooling can cause chapping around the lips and mouth, bad breath, dehydration, and feelings of embarrassment. Why do I drool in my sleep? Your sleeping position. Your sleep position can affect how much drool you find on your pillow in the morning. When a sleeper lies on their back, gravity generally causes any excess saliva they produce to stay in their mouth or travel to their throat. Side and stomach sleepers, on the other hand, gravity is more likely to pull saliva down towards the pillow, resulting in drooling. If you're a side or stomach sleeper who sleeps with their mouth open, you may be even more likely to drool during sleep. Sleeping on your back may help minimize drooling. You can also take measures to breathe out of your nose and keep your mouth closed as you sleep, such as using mouth tape. Infections and allergies. If you are experiencing a cold, strep throat, or seasonal allergies, these conditions can inflame your sinuses and block your airways, causing you to breathe through your mouth and drool more than usual. Other infections such as mononucleosis, tonsillitis, and sinus infections can also lead to increased drooling. Obstructive sleep apnea. Obstructive sleep apnea, OSA, is a sleep-related breathing disorder that causes temporary pauses in breathing while you sleep. Mouth breathing often accompanies or even worsens OSA. Mouth breathing during sleep may make drooling more likely, since drool can more easily escape when your mouth is open. Medication side effects. Excessive salivation and drooling are side effects of certain medications, including some antibiotics, antipsychotic drugs, and medications used to treat Alzheimer's. If you take prescription medications and drool at night, your medication may be potentially the cause of the drooling. Check the list of potential side effects of your medication for drooling. If drooling is listed, do not stop taking the medication. Instead, speak with your doctor first about your concerns and ask if they can recommend an alternative medication that will not cause you to drool as much. How to stop drooling in your sleep. Drooling while you sleep is normal and does not necessarily require treatment. That said, if you believe you drool excessively, there are a number of strategies you can try to stop drooling in your sleep. From lifestyle changes to speech therapy, medication, and surgery. Some treatments are simple, while others are only recommended for more severe cases of drooling. Make an appointment with your doctor to discuss what is right for you. Change sleeping positions. The easiest action you can take to relieve your drooling is to change your sleep position. If you sleep on your side or your stomach, try switching to your back. Be aware that while changing your sleep position, you may need to get a new pillow to sleep comfortably. Side sleepers typically use a much thicker pillow than back sleepers use, while stomach sleepers use a much thinner pillow, or no pillow at all. If you're having trouble staying on your back throughout the night, place additional pillows along the sides of your body to help you stay in position. Treat allergies. If you drool at night and have allergies, your allergies might be the culprit. Allergy treatment could open up your sinuses and enable you to breathe more through your nose instead of your mouth. If you're able to breathe through your nose as you sleep instead of your mouth, you may experience less drooling. Try speech therapy. Speech therapists can teach you exercises that strengthen your tongue and jaw muscles, improving their stability. With speech therapy, you may be able to swallow better, breathe with your mouth closed, and reduce drooling. Ask about medications. People with neurological conditions may be prescribed medication to stop drooling. These medications reduce drooling by blocking the nerve impulses to your salivary glands. However, they commonly produce side effects, such as an overly dry mouth. Ask about surgery. In severe cases of hypersalivation, your doctor may recommend surgery. A few types of surgery are used to treat drooling, including surgical removal of the salivary glands, alteration of the salivary gland ducts, and reduction of the nerve connections to salivary glands. Typically, surgery is reserved for people who also drool during waking hours, and even then it is considered a last resort. After all other options have been attempted and found not to work, studies suggest surgery for drooling works well, with up to 89% of people seeing improvement.